Hey guys, welcome back. Mama Dr. Jones, OBGYN, and Mom 24. Today we're going through some Google autocompletes. I saw Dr. Mike do this not too long ago. I thought it would be fun to put an OBGYN spin on it, so that's what we're doing today. But first, I have to address something from my last video. It's very sad. As some of you know, there was a small carrot on my desk in the whole video. I would like to say that this was purposefully placed to be a joke, but it wasn't. I just didn't notice it. And it was my kid's toy until I had started filming and editing. And then I thought you guys wouldn't even notice. Well, you did. And apparently it's extremely funny to some people and extremely distracting to others. You guys asked me to put it in each video now, and it's missing. I don't know if the kids took it back. It did belong to them after all. Or if I lost it, which quite honestly is very likely. I posted in my community tab about this. Some of you sent me the most amazing graphics of our tiny carrot friend. I decided to make it into a little die cut sticker, of course including a pun, I see you, a reference to our video, and a reference to the beta carotene benefits of carrots for your eyes. You can get a tiny carrot sticker on Teespring. Thank you, Anne-Marie. There were several of you who sent me other carrot images that were super cute, and they are sprinkled throughout this video. There were also a lot of you who reached out and said you were graphic designers. I've filed away all of your emails in case I ever need graphic design. I've included all the carrots that I received here, and yeah. I just thought it was really funny, and thank you guys for thinking that it was funny along with me. Now, if you're not subscribed, please hit subscribe. I know you want to be in on these wonderful inside jokes. We are inviting you to do that today. If you like this video, give it a thumbs up, and we're gonna jump into the content right now. I opened an incognito browser, make it fair. Because what I've been Googling about OBGYNs is, why are OBGYNs so wonderful and amazing? And we don't want to be biased, so get my search history out of the way. All right, let's start with what OBGYNs do. I do obstetrics, which is delivering babies, taking care of women in the prenatal period, some infertility. I do gynecology, which is periods and cramps and endometriosis and surgery. I do a lot of surgery, hysterectomies, ovarian surgeries, tubal surgeries, cervical procedures, taking out fibroids, putting in IUDs, all kinds of things. OBGYNs do everything except eyeballs. I don't like eyeballs. My least favorite rotation in medical school, or like chapter, I think, when we were learning, was pathophysiology of eyes, because I just found it like, I don't know. I don't want to see pins and stuff sticking into eyeballs. That one was boring. We got to find better ones. Why are OBGYN important? We're important because we're people too. No, I'm kidding. Riveting content today, guys. We take on a role kind of as a mixed primary care, specialty care. So it's really kind of a unique field, and I just like it. Like, part of the reason I wanted to go into it is because it's always something different, but it's still super focused. Oh no. The second one is, why are OBGYNs so mean? Some of you saw in my Molly Burke video that some OBGYNs get a bad rap for being mean. This is also a stigma in medical schools for some reason, that everybody thinks that their OBGYN rotation, all the people are going to be really mean. And that's a stigma that surrounds surgery too. I think that there's a twofold reason for this, at least in medical training. And part of it's that women comprise about 80% of OBGYN as a field, at least in training centers. And there's this cultural bias around females, in my opinion, that we're supposed to be warm and fuzzy, and some of us just aren't always like that. And I certainly am not, like, in day-to-day life, just super bubbly and friendly. And I know I come across in these videos as being really upbeat and friendly, but when I'm at work, I'm very focused and like straightforward and blunt. And I think that part of the OBGYNs are mean comes from there's a lot of females in this field who have very strong personalities, and that just gets perpetuated as we're a bunch of bitches. I don't think it's true because I know a lot of OBGYN doctors, and once you get to know them, they're all really great people. Like, I have worked with so many people in this field who are all really wonderful. Now, that being said, I do think there's a lot of paternalistic past in OBGYN that we still need to continue to work on to improve. And that comes across sometimes in some of the things I see people post online about how they were mistreated by an OBGYN doctor, etc. But I think that, again, I don't think as a field we're just a bunch of mean people. In fact, I would say that a lot of the OBGYN doctors that I've worked with have been some of the nicest, most caring people I've ever met. Part of that also is that this is a very high stress field. And so for learners in that environment, it can be really hard to know where you fit in. And for teachers in that environment, especially like young residents, interns, and first year residents who are suddenly tasked with teaching people, but they aren't fully sure what they're supposed to be doing either, that can just be overwhelming and very hard to process. It's not that as a field we're actually mean, but I do think we could probably all work a little bit on our persona, because I know for me, especially when I'm in the zone and really focused, I'm not doing a lot of chit-chatting and I'm not super warm and friendly, and it's just, I don't know. We're not mean, guys. I'm not mean. I have lots of friends who are not mean, and they do the same field of medicine. Look, see how nice I am? Okay. Oh, I hate this one. Why are guys OBGYN? Are there male OBGYNs? This kind of goes along the same lines as the video where Molly Burke was talking about preferring a male OBGYN, which, by the way, I think it's totally fine to have a preference over seeing a male or female, whatever you're more comfortable with. Like, I don't have any problem with that. I think that is completely up to the patient. However, I have a problem with the idea of it being because inherently as a male or female, they're going to be better or worse. Like, I just don't believe in that. I think that is ridiculous. But I think it's okay to have a preference just because you'd prefer or are more comfortable with somebody of a specific sex. That doesn't bother me. I hate this idea, like people wondering, why would a guy want to go into OBGYN? It's so like, oh, it drives me crazy. Why can somebody who has a Y chromosome not want to go into OBGYN as a field? I don't understand that. Like, you don't go to the oncologist and go, I don't understand why you want to be an oncologist. You've never had cancer. It just doesn't make sense. When we choose our specialty in medical school, we choose it based on what we are passionate about, what we really love, what we want to do. OB offers this really unique opportunity to take care of people at really, really happy times, which is kind of rare in medicine, and then also at really, really sad times. And then also you have clinic, but you are a surgeon. Like, this field is just so diverse and wonderful, and you don't have to be someone who seeks OBGYN care to provide it, just like you don't have to have cancer to be an oncologist. I hate this question. Stop Googling this. Stop it. Stop Googling this. Next time you are in a conversation with your friends and they're like, why would a guy want to be an OBGYN? Like, there's some crazy conspiracy. I want you to send them to this video. Share it. Send them here, tell them we have the answers, and it is that they love the field. There, I answered it. Next time I search this, it better just pop up and Google better say, because they like the field. Has there been anything positive? Has it all been neutral or mean so far? Dang it. My OBGYN stripped my membranes. Membrane stripping is a process of doing a cervical exam, and sometimes that can stir up some hormones which can help prompt labor. It's not super reliable. It's not like an induction method. It's just something that sometimes can encourage you to move along into labor if you were probably already moving along that way to begin with. So you wouldn't want to do this until somebody was full-term pregnant, and you would want to talk to them about it before. It's not generally like a terrible or great experience. It's usually just kind of like a cervical exam. So however you tolerate a cervical exam is probably how you would tolerate membrane stripping. Although it does sometimes cause you to have a contraction, which can be painful. So membrane stripping itself doesn't usually hurt, but if you contract as a result of that, then it can be painful. I'm very plus or minus. If somebody really wants me to do it, I'll do it. If I offer and they say yes, then I'll do it. OBGYN is what kind of doctor? Obstetrician, gynecologist. We do pregnancy, prenatal, postpartum care, and gynecology, taking care of people who have a uterus, a cervix, a vagina, ovaries, breasts. Well, everybody has breasts, but you guys know. You know what I do. OBGYN is short for same thing. OBGYN is considered a specialist. So this isn't always interesting too. We aren't specialists in the way that you would think of someone who does like only, I don't know, nephrologists who only do kidneys. But we do have like a more focused scope than a family medicine doctor. So we do 4 years of residency only in obstetrics and gynecology, and then you can further specialize and become a specialist in a particular part of OBGYN. So I could do 4 years of residency and then do 3 years and become 3 more years and become a fertility doctor, or do 3 more years and become a OBGYN cancer doctor, or do 3 more years and become an OBGYN who specializes in urogynecology, which is like the bladder and pelvic organs, basically, like pelvic organ prolapse, incontinence, things like that. And there's a few other specialties too. So I would say it's somewhere in between. We're not specialists like a cardiologist would be, but we're also not quite as broad as family medicine or internal medicine would be. OBGYN is a surgeon. Yes, OBGYN is a surgical specialty. And sometimes when I say that, people think I mean we do C-sections, which is true, but C-sections is like only one of very many surgeries that we do. So most of us do hysterectomies, both laparoscopic, open, and vaginal approach hysterectomies. Some are trained in robotic hysterectomy and robotic surgery. We do ovarian surgeries, ovarian cystectomies, and endometriosis surgeries, taking down scar tissue. We do fallopian tube surgeries, removing cysts from fallopian tubes, removing ectopic pregnancies, all kinds of things. Cervical procedures, preventing and or treating cervical dysplasia and or cancer, vaginal procedures, just a lot of things. So I don't do as much surgery as a general surgeon, but we are broadly trained in pelvic surgery for the uterus and tubes and ovaries and things like that. I'm usually operating at least 1 time per week, and most of the time that is relatively evenly split between C-section and GYN surgery. Why would OBGYN call? There's a lot of reasons that I would call my patients. Sometimes I call my patients just check in and see how they're doing, because they leave my office and I find myself sitting around going, man, I wish I would have asked them XYZ. I don't feel like I completely followed up on that question. I'm going to call them, check on them, and see if there's anything else I can add. Sometimes they would call, like I'm going to have to tomorrow when I get back to the office, because they got called out in the middle of your exam to deliver a baby and they need to apologize. Sometimes they're going to call to tell you that your lab came back abnormal, or your pap smear needs to be followed up on with another procedure or a repeat pap or something like that. They might call to tell you there's an ultrasound result that came back normal or abnormal and just talk about it with you. So I think there's lots of reasons that I would call my patients, and those are some of them. Why do OBGYN take urine samples? I don't know if this means in pregnancy or just in general. So if you split us into people who are coming in for a GYN visit, or like birth control visits or abnormal periods and stuff like that, I would do a urine sample to check for a UTI, to check for pregnancy, to make sure there's no blood in the urine. Those are the biggest things. And then if you're pregnant, one of the biggest reasons we would do a urine sample, well, I guess there's several big reasons. So we can test for STDs in the urine in a GYN or an OB visit, we can test for UTIs. And then in pregnancy specifically, I'm looking for protein, which might make me concerned, especially if it's paired with high blood pressure, that you're getting some kind of preeclampsia, depending on where we're at. So those are several of the reasons that you might be offered a cup to tinkle in when you come and see me. Just what you wanted, right? Speaking of cup, I'm thirsty. It is really hot in here and really echoey, and I'm sorry. And my postpartum baby hairs are looking like a hot mess. Good deal. Good deal. Why do OBGYNs measure your belly? Another great question. So when you are pregnant, we will measure starting around 20 weeks from the top of the pubic bone to the top of the fundus. So a measurement that goes this way. And that is because it should roughly be equivalent in centimeters, that distance in centimeters, to how many weeks you are in gestation. So at 20 weeks, usually from the pubic bone to the top of the uterus, which we call the fundus, is 20 centimeters plus or minus 3. And as long as you're falling within that, we call this size equals dates. Uterine size is equal to expected gestational dates. Now, this comes from many, many moons ago before we had ultrasound, but ultrasound's not super reliable for checking on a size of a baby either. So I kind of like to take these in conjunction with each other. After 20 weeks, I'll start measuring. As long as we're consistently going in the right direction and always within about 2 to 3 centimeters of what we're supposed to be, then we're going to call this normal uterine date, no discrepancy for the size. And if that gets outside of it, then I might order another ultrasound. Things that could cause it to be too little would be the baby is small or there's not enough fluid. Sometimes the position of the baby can contribute to the size being off a little bit. And things that would cause it to be too big would be if the baby was growing too big, there was too much fluid, we had missed a twin. That doesn't happen often these days, but it could. And I just want to look and kind of correlate those two things. So neither fundal height measurements nor ultrasound are perfectly accurate at guessing the size of a baby, but they help us get an idea, and we should be putting together a clinical idea and those things and like making a decision about how worried we are based on all of those factors combined. So in my practice, I'm usually just measuring fundal height and doing additional things if that's off or I'm worried for some reason. Why do OBGYN take blood? That also depends if you're at a OB or GYN visit. So at a GYN visit, we could be looking for STDs. So the STDs that you're testing for in blood would be like HIV, syphilis, hepatitis. Those are the main ones. We don't usually test for herpes in the blood, although there's some circumstances where you would. In a pregnant patient, we usually do all those things, plus a blood count, which sometimes we'd use in GYN too, check for anemia, check for infection. Sometimes we will do blood work to check your blood type, to make sure you don't have antibodies in your blood, looking for immunities to certain things that you're vaccinated for as a child, checking your kidney function, checking your liver function, all circumstantial. Kind of depends what your problem that you came in with was. But those are some of the things we might look at in your blood. Oh, this is a good one. Why would my OBGYN refer me to a perinatologist? A perinatologist is a high-risk pregnancy doctor, maternal fetal medicine doctor, and I sometimes hear people say like, oh my gosh, I'm high risk, I have to not be seen by my OB. There are a few select pregnancy problems that need to be solely cared for by maternal fetal medicine doctors, but for the most part, we take care of most pregnancies, even really complicated pregnancies, and sometimes we do that in conjunction with a maternal fetal medicine doctor. I would refer someone to a perinatologist because I couldn't take care of them at my facility, or I wanted to consult perinatology to help me in the prenatal period, and that doesn't necessarily mean that I won't be the one delivering that baby. Does an OBGYN do abortions? Some of them do, and some of them don't. Does an OBGYN do mammograms? We do clinical breast exams. Like at an annual exam, we'll do a breast exam and teach you how to do breast exam if you want us to. But mammograms are typically done by a radiology tech and then read by the radiologist, who's a doctor that specializes in interpretation of imaging. So I order the mammogram, but I don't actually perform the mammogram. Does an OBGYN look at hemorrhoids? Yes, if you're pregnant, for sure. If you're not, then probably the best person to go to if you had a hemorrhoid would be your family practice provider. But if you're in my office for something else and you happen to have that, then of course we can definitely look at that. But that's not usually something I would see on my schedule as somebody who is not pregnant or coming in for something else related to GYN issues, just coming in for that. Does that make sense? Not making sense to you? Does an OBGYN do pap smears? We do. And a lot of primary care, family practice doctors, advanced practice providers also do pap smears. Where do OBGYN make the most money? I wonder if that's meaning like where in the United States or like where in our field do we make money? I honestly don't know the answer to that. Either one of those. I'm just paid by my hospital, and there's not a ton of correlation with like what I do. I mean, there is a little bit, but not a lot. And then where in the US do they make the most money? Probably places where the cost of living is higher. So I make a lot less than an OBGYN would probably in New York because I live somewhere where the cost of living is really low. Be kind to yourself, to each other, to me. In the comments, be kind, and I will see you